I want to talk about my upcoming pediatrics course. I extended it actually, but to me it's an important one. Now, some of you who have been around with me for a long time know that I've often talked about things like childbirth and ways babies should sleep and morning sickness and things like that, particularly when I'm doing my treatments, the Founders Intensive treatments. I sort of bring in other stuff, but you don't get opportunity to doing that in the normal courses, right? Except I occasionally digress and people ask questions and I put it over, and I think quite a few of you have heard of a few of my tips on this field. But I've been having a long time that I should be doing more of it because it was much more than just an interest for me. It was a major field. And I called it the Pediatrics course. I made a mistake. You'll see I've actually added to the title because it's that whole thing from a couple wanting to have a baby and then find out they can't have a baby, they seem one of them's infertile or whatever, but there's a problem getting pregnant, right? That's one issue, right? Then there's the pregnancy and the types of things that come up in pregnancy and prior to delivery. Then there's the delivery and the things that can come up there, right? And then once the brat's at home for that first 4 or 5 years is what they call pediatrics, and it's the types of things that can go wrong with young children that's different to adults. And there are a lot of things that in young children that if you pick it, you can get dramatic cures by taking a different approach than you would with an adult, right? And there are specific types of illnesses little kids get that often have radical treatments from a medical point of view that can be treated very simply. Because I have found that so many people with BodyTalk who don't have other experiences in professional medicine get nervous about the concept of treating a pregnant woman or a baby or a young child, or even helping people with getting pregnant. And that's understandable because a lot of people, it is a bit scary and you're afraid you might do something wrong, etc. And there's a lot of things that you can't do that are problems that only you'd have to have a specialist do. But there is a lot you can do. I outlined some of it. And to me, there are so many factors in childhood that then lead to the problems later on in life. And so many of the things you are treating when you're treating teenagers or more older people, etc., you're treating for things that started, the active memory and all the different things started in very early life, right? You can often solve really bad problems in a fetus compared to if they're 4-year-old, okay? Much harder because there's so much activity and growth occurring in a fetus and so much dynamism that they can respond really well. Whereas once they're out and the whole world is slowing them down and making them feel weak, I can't do this, I can't do that. They don't have those things as a fetus. They're just floating in luxury type of thing. And their body can respond so much easier. And the same as young children. But I want to just increase consciousness of treatment because at the moment from what I see out there, so many of my practitioners really don't look at addressing very young children or babies, and that there's a little bit of a fear of it type of thing. And yet they're easier to treat and you get into less trouble than you would with a 10-year-old or a 14-year-old. And but you just got to overcome some of that, the fear of it, and also learn some basic things that you do and you don't do. And if you follow what I teach you to do and not what to do and what not to do, then you're going to find you can practice very safely and see dramatic changes.